Hey guys, this is Dr. Marcy at Agility Physical Therapy and Sports Medicine, and I'm standing outside our clinic today because I want to talk to you about a mistake that I made. See, in this business, it's really easy to get caught up in, I can help this person, and you really want to help that person, but sometimes they have to want to help themselves. In a new movement in this country called functional medicine, people are trying to find ways to help patients help themselves. But how do we do that when insurance is driving everything? It's a big question, and it's a big question partly spurred by the chronic pain debate. How do we help people who can't otherwise help themselves, or don't want to help themselves, or don't know how to help themselves? I'm telling you about the mistake that I made because it made me realize that I'm not meant to save everyone, and not everyone wants to be saved. If you look at the situation, basically, I had a patient who's been in chronic pain for 6 or 7 years, and several things have been recommended to her over time, and she's rebuffed every single one of them. Her pain has become such a part of her identity that I'm not sure she knows who to be without it. She's isolated herself and come to tell her practitioners what she thinks is best for her, but then not taking their advice, and has become uncoachable. When someone becomes uncoachable, they're unwilling to learn. They're unwilling to be helped. And our job as practitioners is to recognize that and actually put a stop to the care we're providing if all we're doing is chasing symptoms. If you are looking for ways to actually get better, sometimes you have to do that outside of what's considered normal medicine. Normal medicine approach is you go to the doctor, you might have 5 to 8 minutes in a room with them, they listen to your symptoms half-heartedly and they prescribe you something. What if you could do something better? What if you could have something better? What if your practitioners weren't cuffed by insurance? Yes, a lot of people have complaints about this concierge style of medicine, but what if it's actually the answer to getting better? I keep hearing over and over again how insurance companies want people to be consumers of healthcare. But if all of the contracts are preset and you don't have a choice in where you go or how much you pay in your deductible amount, how can you be a consumer of healthcare? If you can't price shop and benefit shop and basically outcome shop your providers, how do you truly know you're getting what you need? What I would recommend to you is that you take a look at your healthcare expenses over the last year. Think about what it is that you really, really, truly want. Do you want a provider who cares for you, who spends the time with you? Or do you want a provider who says, okay, that sounds like this, let's prescribe you this, and you walk out the door, paying for another prescription that you may or may not need and that you may or may not take? The best example of this that I can give is 2 years ago, I went to my family physician, told them that I was having significant sacroiliac or SI joint pain. It was caused from a car accident I was in when I was 16 and I'm now 38. And I told my physician, I can't really do pain medication because they make me non-functional. I can't do muscle relaxers because they make me hallucinate. And I'm a little bit worried that I have an autoimmune disorder because they run in my family. What I got back was a prescription for a muscle relaxer, a prescription for a painkiller, and a referral to a rheumatologist. While I appreciated the referral, the doctor didn't hear me and just prescribed a medication that I never even went and picked up. How do we change that system? My suggestion is that you actually look at your high deductible plan and putting away money into that HSA account, and then truly shop doctors. You can submit claims on your own to your insurance company through their web portal and through the patient portal. You don't need your doctor to do that for you. And I would bet if you say, I'm willing to pay cash for those services, that doctor would spend more time with you and give you more of what you need. I think we're so in a habit of saying insurance should cover everything. I pay a lot of money for this. It should cover everything. The truth is, it covers hardly anything anymore. My out-of-pocket expenses this year will be about $12,000. and I'm still not sure that I'm getting the care that I need. So what do we do to make this change? I hope this helps you make decisions about your family's insurance plan and what you want to do in the next coming year regarding your health. You can email me at drmarci@agilityphysio for questions, and I'll be happy to speak with you. Have a great day.